At the height of the pandemic, at a time when over 70,000 Americans were hospitalized with COVID-19, salaries for travel nurses reached an all-time high of up to $12,000 per week for some assignments. So, what was behind this unprecedented surge in the demand and the subsequent increase in pay rates for travel nurses? Is travel nursing dead? Demand for travel nurses skyrocketed, creating a perfect storm that dramatically changed the travel nursing landscape. Hospitals were scrambling to find nurses, but the demand was higher than anyone could have ever imagined.
And I've seen numbers anywhere from $3,600 a week up to almost $8,000 a week.
This meant that nurses could earn in just 2 to 3 months what would have previously taken them an entire year. However, these high-paying assignments were often in places described as war zones.
Hospitals are under siege.
All the patients in this room, all the feet that you see, they all have COVID.
During the initial wave of COVID-19 in the United States, New York City quickly became the epicenter of the outbreak, with hospitals and healthcare facilities overwhelmed. Travel nurses were urgently needed to support the overburdened healthcare system as a result. Travel nursing agencies offered premium rates, sometimes up to $8,000, $10,000, or even $12,000 per week to entice nurses to accept these challenging assignments. While urban areas like New York City faced immense challenges, rural hospitals were not exempt from the pressures of the pandemic.
With more people testing positive for the coronavirus every day, rural hospitals are struggling to keep up. We got a look inside Minidoka Memorial in southern Idaho, where they have 17 beds and room for only 3 COVID patients.
Travel nurses were brought in to help these hospitals stay afloat, and in turn, they were offered competitive pay rates to work in these remote locations. Since the peak of the pandemic, the average pay for travel nurses has fluctuated more than it has ever in the history of travel nursing.
But recently, their pay has started trending downward. The Indiana Hospital Association says throughout the pandemic, travel nurse rates jumped as high as $300 an hour. Now it's come down to $120 to $190 an hour.
As of November 22, the average travel nurse could expect to earn around $2,632 per week. But it is understood that this figure will only continue to evolve as the supply and demand for nurses shift from the demand we had during the peak of COVID-19 to what we are seeing today. Travel nurses generally earn more than staff because the demands of their jobs are greater. They are tasked with alleviating staffing shortages in hospitals and healthcare facilities that struggle to fill their staff positions with permanent nurses. Economics tells us that prices change based on supply and demand. For example, if there are 10 nurses, supply, to fill 50 positions, demand, the pay rate for these nurses will quickly become competitive. In some cases, during 2020 and 2021, you even had nurses naming their own rates. Travel nurses working in cities with a high cost of living, like San Francisco or New York City, received higher pay rates to compensate for the increase in living expenses. Similarly, assignments in remote or rural areas might offer higher pay to attract nurses willing to work in those locations. Travel nurses with specialized skills or certifications, such as operating room nurses or intensive care unit nurses, are also able to command higher pay rates due to their expertise. In early 2020, there were around 8,000 open positions for travel nurses. However, by September 2021, this figure had grown to over 48,000 positions. It's evident that the pandemic has had a significant impact on the travel nursing industry. In response to the surge in COVID-19 cases, hospitals and healthcare facilities across the country scrambled to increase their capacity and staffing levels. As a result, travel nurse positions multiplied in record time, leading to an unprecedented number of open assignments. These positions were not limited to COVID-19 units, but also extended to other areas such as emergency rooms, ICUs, and medical surgical units as healthcare systems struggled to manage the influx of patients. The pandemic has also led to an increase in travel nursing assignments outside of the traditional hospital setting. Travel nurses were deployed to alternative care sites like field hospitals and makeshift clinics to help manage the overflow of patients.
And number 1, tents are being set up outside LBJ Hospital to deal with the rise rise of COVID patients. Hospital officials tell us that they are currently in a state of internal disaster because they have too many COVID patients and not enough staff to take care of them.
They also supported vaccination efforts at mass vaccination sites.
Tonight, the push to get the vaccine into the arms of more Americans. Mass vaccination sites opening today at stadiums across the country, from Phoenix to San Diego, Miami to San Antonio.
As we move towards a post-pandemic world, several factors will influence the future of travel nursing. But what are those factors? The pandemic's long-term consequences on the healthcare system, such as addressing the backlog of non-COVID-19 patients and managing long-haul COVID-19 cases, may continue to create a demand for travel nurses. As the population ages and the prevalence of chronic illnesses increases, the need for healthcare services is expected to rise.
Sit at my desk, staring at the computer screen, unable to shake the feeling that something is off. I have just looked at the latest employment projections from the Bureau of Labor Statistics, and the numbers are startling. According to the report, the registered nursing workforce is expected to grow 6% over the next decade. That means that the RN workforce will go from 3.1 million in 2021 to 3.3 million in 2031, an increase of 195,400 nurses. But the demand for nurses doesn't seem to be slowing down anytime soon.
The ongoing nursing shortage in the United States, exacerbated by factors like the retirement of the baby boomer generation of nurses and the increased workload during the pandemic, is going to be a major contributor to the continued need for travel nurses. Travel nurses have the opportunity to make the most of this evolving landscape and maximize their career opportunities. And if you are looking to start your career as a travel nurse or are a travel nurse yourself in search of your dream assignment, then there is no better place than Vivian Health, the sponsor of this video. Vivian Health is the go-to company for everything travel nursing, and it is a company that is trusted by every travel nurse in the industry. Are you looking for location-specific postings? Do you need in-depth salary data and analytics? Do you want to read articles containing information that will provide you with valuable data to help you grow your income? Then Vivian Health is the website for you. With Vivian Health, you will be able to create a profile to get travel assignments that are perfectly matched for you. You will also be able to look at tens of thousands of job postings in any specialty, location, or salary range of your interest. Click on the link in the description below to create your free profile and start looking for jobs today. While the pandemic has caused considerable fluctuations in pay rates and the demand for travel nurses, travel nursing remains an essential component of the healthcare system. So, to answer the original question, is travel nursing dead? No. When you still have over 60,000 positions listed on a website like Vivian Health, travel nursing is very much alive.
But travel nursing will still be a significant part of the overall picture for a while.